Good afternoon. My name's Neil Hetherington, and I have the awesome privilege of being the CEO of the Daily Bread Food Bank. I want to welcome you to this webinar. In 3 months ago, when Daily Bread was struggling, being able to get the food out that is demanded by the city, our VP of Research and Advocacy, Talia Bronstein, made the wise observation that we should stop for a moment and pause just on food distribution and analyze what is going on in the current environment that we were all faced with, research it so that we could provide recommendations to government and other stakeholders and duty bearers to ensure that everybody's right to food on a systemic basis is realized. And I'm glad that she made that decision. And what was born from that decision was the research paper that we're going to be talking about today. That research paper is called Hunger Lives Here: The Risks and Challenges Faced by Food Bank Clients During COVID-19. At the bottom of your screen today, before we begin, we've got a couple of housekeeping items. The first is to let you know that we will be taking questions after each of the two presenters has spoken. We would ask that you put those questions into the Q&A portion at the bottom of your screen, and we will hope to get through each of those during the course of the presentation. If we're not able to get to the question during the presentation, we will endeavor to answer those questions and get back to you. The other housekeeping item to let you know that we are recording this session. We won't be seeing all of the viewers' faces on this, but we will be seeing Valerie, Tarasuk, and Talia Bronstein as they speak today. So it is being recorded. So that, I think, concludes the administrative portion of this and the introduction. And now I'm going to introduce our speakers. First, to introduce Talia Bronstein. I've known Talia for just over 1.5 years when she assumed the role here as VP of Advocacy and Research. She holds a master's degree in public health from the University of Toronto, spent her career at the intersection of research and policy, trying to advance upstream approaches to improve health and well-being through poverty reduction and access to community-based services. Her experience in the public, private, and not-for-profit sectors provide her with a unique perspective in building collaborative relationships between community members, partner organizations, and government to tackle complex systems and system-level policy issues. Since becoming a member of the Daily Bread team, she has taken our Who's Hungry report to the next level. She has advocated for those systemic changes and done so in such a fantastic way. And I'm delighted that she is the author of this incredible report. Valerie Tarasuk, our other speaker today, is a professor in the Department of Nutritional Sciences at the University of Toronto and the principal investigator of Proof, an interdisciplinary research team investigating household food insecurity in Canada. Val has worked to uncover the scope, nature, and health implications of food insecurity in Canada, assess the effectiveness of community responses, and determine how public policies and programs impact food insecurity prevalence and severity. Her research work includes researching the relationship between food insecurity and food charity. Val is also an ex-board member of the Daily Bread Food Bank from a number of years ago, and has been one of the foremost commentators on the issue of food insecurity across the country. And Val, it's really a privilege to have you in this, to provide the forward to this research paper, and to give us a lens on the broader context. So while Talia is going to speak now about what our local research paper had to say, followed by Valerie speaking about the broader context, and then we're going to take some questions. I'm delighted that both of you are here this afternoon, and really look forward to what you have to say. Talia.
Wonderful, thanks, Neil. I am just going to share my screen. Hopefully that worked there. So I'm really thrilled to get to present to you the findings from our latest research report, Hunger Lives Here. And as Neil mentioned, this really came about based on what we were seeing kind of anecdotally through our food banks during COVID-19, but we really wanted to go out and quantify what we were seeing to get the stories of individuals who are experiencing food insecurity during the pandemic. And that's what really produced this report. So before I jump into the findings, just a little bit about Daily Bread Food Bank. Our mission is to eliminate food insecurity and also to advocate for solutions to end poverty and food insecurity. And we do this by distributing food to over 170 food programs across the city of Toronto, while we're also conducting research and engaging in advocacy around those long-term poverty reduction goals, in recognition that in a city like Toronto, poverty is ultimately the root cause of food insecurity. So before we jump into the findings of this report, just a bit of context setting, how food banks kind of adapted to the pandemic. So when COVID-19 hit, food banks, like most community programs, were forced to rapidly adapt. So usually food banks in Toronto are set up to be kind of a grocery store model where people can choose the foods that they want that meet their dietary needs. But as a result of the pandemic, a lot of our food banks shifted to an emergency food hamper type system where people were allocated a box of pre-packed food based on their family size. And the government of Ontario was helpful in supporting this initiative by providing funding to our provincial association, Feed Ontario, to distribute 450,000 emergency food boxes across the province. And early on, we had a number of food banks that had to close down because they were in community centers that were run by, community centers that were mandated to close. They were run by volunteers who were high risk for COVID-19, or they were in spaces that were too small to physically distance. So that forced us to really act quickly to close geographic gaps in access. So through a number of community partnerships, we were able to open temporary pop-up locations for food banks. And now I can say that we have actually both restored and increased service locations as a result of the pandemic. And you can see here on the bottom, this kind of warehouse space. This is actually the City of Toronto's, Toronto Public Library's book distribution hub, which was transformed into a food packing warehouse. So through a lot of interesting partnerships, we were able to get food out the door during the pandemic. But as Neil said, we realized that not only do we need to be meeting that immediate need, but this is a critical time to be doing research to really understand what's happening. So that's where this report was born. So through the pandemic, we have heard a lot about the critical role of frontline workers, be they healthcare workers or other service providers on the front lines who are there showing up, doing their jobs, potentially putting themselves and their families at higher risk for exposure to COVID because they do what they need to do to get their job done. They're committed to doing that work. But what we hear less about is the people on the other side of the front line, those who had to continue to access services, the people who are on the front lines because their most basic needs were not being met. So they had to go out in the pandemic to make sure that their needs were met by accessing programs and services. So these individuals weren't on the front line by choice. They were there out of necessity to access the food they needed. So our research is based on 221 phone surveys with food bank clients across the City of Toronto, as well as an analysis of food bank client intake data. And before I jump into the findings, I just wanted to acknowledge a lot of people made this report possible. First and foremost, the 221 food bank clients who shared their time and expertise and experience with us, the member agency food banks who helped us recruit participants, my co-authors, Peter Oakes, Catherine Hugh, Tyler Schneer, and as well as we had a number of interviewers, a fantastic research committee, and also Val, who provided input and guidance throughout this process. So thank you so much for your input along the way. What did we find? Well, our first finding is that food bank use has increased due to COVID-19. You can see on this graph in this red bar, that's the average weekly visits to Daily Bread member food banks during COVID. And you can see it's hovering around the 20,000 mark compared to 2019, which was hovering around the 15,000 mark. So that's about a 25% increase during COVID. And what's concerning about that is that a large portion of that was actually driven by new clients. So for the majority of these, 3/4, they began accessing food banks primarily because of COVID-19. They experienced job losses, a reduction in hours. So we know that the pandemic directly led to an increase in food bank use. But what is perhaps more concerning is that the severity of food insecurity has increased. So you can see here the frequency of going a whole day without food. So for our clients, about 1/4 of respondents had gone an entire day without eating in the past few months. And for those that had this experience, the frequency of that happening almost every single month increased by 20%. And we know that this has a lot of health implications, which Val is going to talk a little bit more about. We also know that the frequency of stress and anxiety around accessing food really increased as a result of the pandemic. So we can see here that the number of respondents who experienced moderate to severe stress about being able to access enough food tripled. The number of people experiencing that almost every single day tripled during the pandemic. And you can see that on the left-hand side here, the number of respondents who weren't really experiencing much stress and anxiety really decreased during the pandemic. So more people were experiencing that stress. Now, this is a map you may be familiar with. This is from the City of Toronto's Toronto Public Health data on COVID cases per 100,000. And this is a map that was presented in a Toronto Star article. And you can see here that COVID cases, there's some hotspots in the northwest corner, as well as in Scarborough. And when we look at how that maps onto other variables, we can see that in terms of the proportion of people living in unsuitable housing, so for example, it might be overcrowded, we can see that COVID cases map on very closely to the percentage of people living in unsuitable housing. If we look then at percentage of respondents who identify as Black, a similar pattern emerges where we see a really close correlation between severity of cases as well as respondents or residents who identify as Black. When we look at income, we see that those with the lowest incomes face by far the highest rates of COVID-19. And this is no coincidence. COVID-19 does not equally impact all of us. It is like many viruses and diseases, it discriminates. And we saw this with food bank clients as well, where close to 60% of food bank respondents were in occupations that faced the highest COVID-19 cases. So sales and service, trades, transport, manufacturing, utilities. And only 5% of our respondents had both dental and drug benefits, which both further increases the health risks associated with COVID-19, but also just goes to show that these jobs are predominantly precarious employment. So not only were food bank clients more likely to become exposed to COVID-19, they were also more likely to experience severe illness from COVID-19. So as you can see here, just over half of our food bank respondents could be considered high risk for severe illness from COVID-19 because they were either 60 years or older and or had a pre-existing health condition. This compares to about 27% of the population of Canada as a whole. So food bank clients are about double that in terms of being high risk. So again, more likely to have exposure to the virus and more likely to have severe illness from the virus. And the pandemic ultimately took a big toll in terms of both physical and mental health. Here are some of the quotes from participants. We know that before the pandemic, a lot of food bank clients were accessing a variety of social supports and services, and a lot of those closed down during the pandemic. On top of that, the social isolation of being in lockdown can really exacerbate the experiences, the challenges people were already having. So this top quote here on the left-hand side talks about how all the services this individual relied on were shut down. They couldn't go to counseling. They were supposed to go to their doctor. They couldn't have an appointment. So they felt that that had really put their health at risk. And then in this bottom corner, you can see the impact of losing social programs and community engagement. Not being able to go to your community garden, not being able to have that social connection can be really isolating. And this quote in the middle is the one that has really stuck with me weeks and weeks after we completed this research. And it's just that, you know, the experience of living in poverty was already difficult. It was already taxing. It was already mentally strenuous. And then on top of that, there was a pandemic, and that just made everything simply too much. So you can see that there was a real toll in terms of people's experience during the pandemic. So on the bright side, the silver lining, I think, of the pandemic was that we had really rapid responses of government. In a press release, the Canadian government said that no Canadian should have to choose between protecting their health, putting food on the table, paying for their medication, or caring for a family member. And so a lot of different supports, income supports, were rapidly rolled out, the most notable of which is the Canada Emergency Response Benefit, or CERB, which provides $200 or $2,000 a month to individuals who, for example, were laid off from their job, or had reduced hours, or had to self-isolate as a result of COVID. And unfortunately, we can't quantify just how many individuals were helped to avoid coming to a food bank as a result of getting CERB, because we only have access to individuals who did come to a food bank. But we are fairly certain that if CERB hadn't existed, food bank visits would have been considerably higher. So we know that that income support really helps a lot of families to be able to afford their basic needs, to be able to pay for their groceries. So it's a really important benefit. But with all policy responses, nothing is perfect. And in this case, these policy responses were rolled out really quickly. And that was important and needed to happen because people were losing their jobs very rapidly. And we know that Canadians don't have a lot of savings in the bank to withstand any kind of financial hit like that. So it's really important that those were rolled out quickly. But of course, that leads to some gaps and challenges. So what we found is that for households that had experienced a job loss in our population, about 28% had received CERB. So what does this mean? It tells us two things. One is that for those 28% of families, although they were receiving that income support from the government, they were still unable to afford all of their basic needs. And in a city like Toronto, it's not surprising. If you're getting $2,000 a month, if your rent is $1,400 a month, and then you have to take the TTC to get to work, that quickly eats up that $2,000 a month benefit. So for those individuals, they still had to come to the food bank. The other thing it tells us is that there were some gaps in coverage of CERB. So for some people, it was a real ineligibility. They maybe didn't have the income threshold they needed to qualify for CERB. They didn't have work permit, that's the word, work permit to be able to qualify. But for others, it was a perceived ineligibility. They were worried that they would be penalized for it. It would impact their immigration status. They would lose their social assistance benefits. The other thing to note is that 60% of food bank clients receive social assistance before COVID. And for those individuals, we were very concerned early on that they would have trouble making ends meet. Even though they're on a fixed income, and that won't change, the cost of living will essentially be higher because a lot of the community supports were no longer there. And John Stapleton, who is a very well-known social policy researcher here in Toronto, coined this an isolation deficit. So for those individuals with such low incomes, the lockdown actually makes things more expensive because you can't price shop. You can't go use flyers and go grocery store to grocery store. You can't access your community programs that you normally access. So the cost of living actually goes up. So the Ontario government implemented a benefit. It was a discretionary benefit though, which meant that individuals on social assistance had to call their caseworker and make the case saying, I need extra funding, which meant that the caseworker could say no. We also had 1/3 of our respondents said that they weren't able to access that because they didn't know about it, they couldn't get a hold of their caseworker, or they were denied the benefit. So again, a gap in access. And one of the most concerning things, I think, is the increase in deep housing unaffordability. So we had the number of the respondents paying 50% or more of their income towards housing increased from 67% to 81%. So what is this 50% threshold? Housing affordability is typically defined as about 30% of your income going or less going towards housing. Anything above 50% is considered deeply unaffordable and puts you at higher risk for homelessness, which means 81% of our respondents are now falling into that category of deep housing affordability and higher risk for homelessness. And 34% of respondents said they'd be unable to pay rent 4 to 6 months from the time of the survey. Now, this is very concerning because the eviction ban is now lifted, and now these individuals are starting to, if they've had rent arrears, be facing proceedings around eviction. So that's something we're really concerned and watching closely. Where do we go from here? COVID has clearly followed passive inequities that were already deeply ingrained in our society, and it's really exacerbated and shone a light on things that were already there and just have been exacerbated. But the good thing is that we've had really rapid responses. So this is an opportunity to build on the lessons learned. So where do we go from here? The first area is to prioritize and enhance income support. CERB was crucially important during the pandemic, and we were concerned what would happen when CERB ended. Luckily, the federal government is working on a transitional benefit through employment insurance, which we're going to monitor closely to see what that actually looks like once they release details. But our employment insurance system pre-COVID was not up to the task. It was not reaching people who are not in traditional forms of employment, who are in part-time, precarious, they might be independent contractors. It's not reaching a lot of individuals who are whose incomes were affected. So that's an area that we see as a real opportunity to reform. And the second is around social assistance. The rates are far below the poverty line, and as a result, this just adds to the lack of resiliency to a health crisis. It puts people's health at risk, it puts their safety at risk. So social assistance is an area that needs to be addressed as well. The second is protecting and building affordable housing. If a second wave of COVID happens, we simply cannot risk having people lose their homes in the midst of a second wave of a pandemic. So we're looking to the province to support individuals who have accrued rent arrears to help ease that process, to make sure that they maintain their homes so that they don't become homeless during the pandemic. And the third is improving and expanding health benefits. So most food bank clients who are employed are working in precarious jobs. They don't have access to health benefits. Most of them don't have access to paid sick days. So it's really critical that we reinstate paid sick days for employees permanently. But also, I think pharmacare is a huge opportunity. The federal government had an advisory council around it that issued a number of recommendations. So it's critical that now that we're coming out of COVID and we're looking to strengthen our society, build resiliency, that we focus on what makes people healthy and well. And part of that is access to medication. So if you're going to take one thing away from this presentation, I hope it's that you can see that in Toronto, food insecurity is an issue of income insecurity. And while food banks can help provide temporary assistance to meet people's immediate needs, if we want to really tackle food insecurity, then we need to be looking at these policy levers. We need to be looking at ensuring that every person living in Canada can afford their basic necessities. So as we're looking to COVID recovery, it's critical that we prioritize poverty reduction at the center of our recovery efforts. So that is it for me, and I am going to stop sharing my screen and pass it over to Val.
Okay, I'm going to start sharing mine. Okay, so thanks very much for including me in this afternoon's webinar. It's really an honor to be a part of this thing. So my task or my assignment for this 15 minutes was to talk about what Hunger Lives Here, the report that Daily Bread has just released, what it tells us in relationship to what we already know about food insecurity from the population. Before COVID and the pandemic really hit Canada, we had a picture to actually improve. We had just released about food insecurity based on data from a very large population health survey run through 2017-18. And what you can see here is one of the infographics from that report. What did we figured out? That 1.8 million Canadians were living in food insecure situations. So 1 in 8 households. In Ontario, the rate was a little bit higher than it was nationally, and in Toronto, a little bit higher still, with 13.6% of households being classed as food insecure. When we translate those households into head count, we had 4.4 million Canadians in 2017-18 living in food insecure situations. And as you can see from these bars, that's a higher number than anything we had documented before. So the problem of food insecurity pre-COVID was large and it was festering. If anything, it was getting worse. How did that problem relate to food banks? Well, this might surprise you, but when we look at the number of Canadians living in food insecure situations based on these large national surveys, that number is typically way, way higher than the number of people that are reported to be using food banks in Canada. And that's been true for as long as we've had data. What's important to take away from this picture, though, are a couple of things. Food bank usage, because food banks are such a tough thing for people, it's a strategy of last resort. So it tends to be a strategy that's used most commonly by people who are severely food insecure, which means people who are very, very vulnerable. So while there's a large disconnect in the numbers, food banks have always in Canada, and continue to be, I think today especially, a canary in the coal mine, telling us something really important about one subset of the food insecure population, and that subset being those who are extremely vulnerable. It matters that we pay attention to who's food insecure and who's severely food insecure, because the health implications of food insecurity in Canada are devastating. This is a laundry list of a whole bunch of studies that you can see listed at the bottom that have looked at the relationship between different aspects of health and food insecurity in Canada. And what you can see is whatever we look at, the situation is worse for those who are food insecure. And for those severely food insecure, it is worse yet. In particular, we see higher prevalences of both chronic mental health problems, but also a whole range of physical health problems, and also poor disease management. And that's true for adults and for children. So people are more likely to have health problems and they're less able to manage them. Another way to talk about that is this. It's work we did a few years ago in Ontario looking at the relationship between food insecurity and healthcare use using OHIP data. So this is data for adults, and what you can see is adults in more severe food insecure situations burn up, on average, over the course of a year, more than double the healthcare dollars of people who are food secure. How come? Well, they're more likely to have problems, but also they're less able to manage them. Another manifestation of that terrible, terrible reality is this one. More recent data that we published looking at mortality and food insecurity. People who are food insecure die quicker. They die earlier. And they are more likely to die earlier, both from chronic conditions like, heart disease, diabetes, cancer, the things that we're most commonly concerned about, non-communicable diseases in Canada. But also you can see at the top here, this dark story, which is the much, much higher rate of mortality from communicable diseases and injuries. We're miles from having data on what this picture looks like after COVID. But given the patterns that we are seeing here, we can only assume that people who are food insecure, as Talia said, are going to be more likely to be hit by COVID, but they're also probably going to be more likely to have negative health outcomes, such as this one. Why are people food insecure? What does it reduce to? Well, this is my very simple-minded equation. Food insecurity ultimately is a story of household resources, and therefore it's a function of both household income and assets. If an example of the income story is the very, very high rates of food insecurity among people on social assistance. In Ontario right now, at least in 2017-18, that was 59%. Social assistance I offer as an example because it's a beautiful example of an income source that is both insecure and inadequate. With respect to assets, the best example we have of that from the population survey data that we analyze is home ownership. People who are renters are way more likely to be food insecure than homeowners, and that's because home ownership indicates wealth, right? It indicates a history of wealth and assets that you can draw on if something happens, like you lose your job. I think the story of income and assets and how central it is to food insecurity is a big part of the explanation for the racialized aspects of food insecurity. We know food insecurity is way more common among people who are Black or Indigenous. We also know, though, that systemic racism makes it more difficult for those people to access income and assets in ways that would protect them from food insecurity. What do we know about food insecurity since COVID? Well, one thing. A few weeks ago, at the end of June, Statistics Canada released a report on a little survey they did of food insecurity since COVID. It was an online survey of 4,600 people living in the provinces. It ran for 1 week during the month of May, and it included 6 questions asking about people's experiences of food insecurity in the last 30 days. Here's what those questions look like and those results. The questions are asking about people's inability to access enough food or balanced meals, the kinds of food they like. And what you can see are quite different stories for households, people living in households with children and people in households without children. 19.2% of people living in households with children reported at least one of these experiences in the last 30 days, compared to 12.2% of people in households without children. And this is typical of what we see in food insecurity, but it's actually an exaggerated difference whereby having children predisposes people to greater vulnerability. When Stats Canada analyzed the relationship between food insecurity, as indicated by those 6 questions, and employment status, not surprisingly, people that had experienced loss of work because of COVID were way more vulnerable. So 28.4% of those people were reporting food insecurity based on those 6 questions. So that's huge, right? Over a quarter, as opposed to 10% who were able to carry on working as normal. So there's no question that that COVID-19 and the shutdown, the economic downturn associated with it, is having a profound impact on the problem of food insecurity in Canada. The comparability of these data sets is always complicated, but Statistics Canada did their best to compare the results from that survey in May with what we knew before. And not surprisingly, it shows that we've got a much higher rate of food insecurity now than we did before COVID-19. The 14.6% that you're seeing, though, on this arrow is unquestionably an underestimate, because that online survey underrepresented some very vulnerable groups. And most significantly, I think it underrepresented people who are renters, who we know to be at high risk of food insecurity. So the story is bleak here, but it's probably not even as bleak as the reality. And so we get to talk about Hunger Lives Here, because in the context of very sparse data, like the material I've just shown you from Statistics Canada, surveys like the one that Daily Bread has just released are really, really important, because what they give us is a strong light on a very, very vulnerable subgroup of the food insecure population, and a subgroup that, as Talia said, is growing. I think there are 2 takeaways, or at least for me when I read that report, there are 2 takeaways. The first one is just how easy it's been for people to fall through the cracks of the very hastily constructed safety net that we've had since COVID. As Talia mentioned, what do we learn about CERB from this report? Well, that it hasn't worked for everybody, right? There are people who have lost work but haven't received CERB, and there are people receiving CERB but still not able to make ends meet. These are holes that really need to be patched going forward. Similarly, we've got stories about social assistance recipients not able to access the top-up. I think we have an evolving story of people who are very low income but haven't been able to benefit from the federal government's top-ups of the GST credit and also the Canada Child benefit. So looking at Hunger Lives Here has taught us some things about where the holes are in the existing safety net. The second really important learning, in my view, from this report is how extremely vulnerable people are right now. Not only do we learn about very, very serious levels of food deprivation amongst the people using food banks in the last month or so, but we also learn that their vulnerability transcends food. And we've seen that theme play out in national data for a long time now, but I feel like the Hunger Lives Here report really puts it into perspective in a way we haven't seen for a while. One of the most frightening findings for me in this report is the very, very high levels of rent arrears amongst people who completed the Daily Bread survey. I think we have real accumulation of debt in these households now, and unquestionably we're going to see problems with evictions coming forward. So while on the one hand we've got a huge mobilization of community resources to try to provide emergency food assistance to people, we've got this big elephant in the room, which is people's inability to pay rent. On top of that, as Talia mentioned, there is an ongoing theme of people with limited access to drug benefits and other sorts of extended health benefits, including things as fundamental as sick leave, and stories of chronic physical and mental health problems that can only be worsened in the context of COVID-19. So the vulnerability is large. Yes, there's a vulnerability that is manifest in terms of food deprivation, but we've got cascading vulnerability when we scratch the surface of these people's daily lives. So Talia ended her presentation with a very clean slide telling us about directions, summarizing the policy recommendations that appear at the end of the Daily Bread report. I want to end with something way muckier. Just to flag the research that parallels the policy recommendations that Talia talked about. We have an abundance of research, or a growing body of research at least, looking at the relationship between specific policy interventions and food insecurity in Canada, and in Ontario particularly. And what that body of evidence shows overwhelmingly is that policy interventions that improve the financial resources of low-income households matter. And making those benefits more generous reduces the risk of food insecurity. So it's important to recognize that the policy recommendations that Talia talked about and that others have called for, there's an urgency to act on them because of the vulnerability of people who have fallen through the cracks now, and the growing numbers of people that appear to be falling through the cracks in our safety net. But also, there is a body of evidence to support alternatives, right, to support better policy actions right now. Okay, I'll stop there. Thank you. And I'll stop sharing my screen. Stop sharing. Stop sharing. Okay.
I want to thank you both. Those insights, both at the local level and immediate need level, and systemically, are impactful, and I hope the catalyst for change. I want to remind people that there's the opportunity to ask questions in the Q&A portion. A number of you have already done that, and so we appreciate that. And so I'm going to throw the first question and ask that both of you respond to this, perhaps Val starting first. The question from Cheryl: wouldn't a universal basic income make events like COVID-19 less a financial burden to those below certain income levels? So if you could speak a little to the idea of a universal basic income.
Gladly, and thank you, Cheryl, for that question. I mean, one of the observations I think from Hunger Lives Here is just how easy it's been for people to fall through the cracks. And a universal basic income, the notion of an income floor that is guaranteed and that everybody gets, is a way to deal with those cracks. And so I think that's, for me, one of the selling features of that as a policy alternative. If you don't put something like that in place, you have no choice but to piecemeal income supports across the spectrum, and then you always risk having people fall through the cracks. So, you know, we either have to patch the holes we've got, or we've got to create something that is less vulnerable. And, you know, I mean, there are many arguments, I'm sure many people on this call are already aware of them. There are many arguments against a universal basic income, you know, not the least of which is the cost of it. But for sure, the issue of falling through the cracks is an ongoing theme as it relates to food insecurity in Canada, and particularly at this time. So it's something for us to be contemplating very seriously. I'll stop there, Talia.
Yeah, I think Val's research really shows that there's a clear relationship between income and food insecurity. And whenever we've given income supports, it's had an impact on food insecurity for the positive. So I think a basic minimum income floor is absolutely critical to advancing or to reducing food insecurity, whether that comes in the form of basic income versus another kind of setup. You know, I'm less opinionated on particularly, but I think what's important to note is that, number one, income is critical, and we can't have people falling below a threshold. Our social assistance rates are just beyond inadequate, and that's really fueling food insecurity. But at the same time, we also need to remember that income, although necessary, is not sufficient to move people out of poverty. We also have mental health challenges. We have barriers to employment. We have a lot of other issues that people need those wraparound supports. So I think we need that minimum income floor, but we also need to remember that we need those broader social programs to continue to operate to support people in their diverse needs.
Talia, in the paper, you speak to the level of social assistance versus what the federal government has set as the poverty lines in the market basket. Do you want to just remind and tell the people who are watching what that delta looks like? Because I think for me it was stark.
Yeah, individuals, a single individual receiving Ontario Works receives about $730 per month. For somebody who's receiving Ontario Disability Support Program, a single individual, it's about $1,200 a month. So that compares to what individuals were making on CERB, which was $2,000. And so you can see already that there's a huge disparity there. And I think the other interesting thing, kind of going back to the basic income piece, that I really took away from this was we've basically just done a bit of an experiment in a basic income, not a full universal basic income, but I think in a city like Toronto, it was really interesting to see that CERB doesn't get you as far as it would in a smaller city where the cost of living is lower. So I think we have to be really mindful of those geographic differences as well. In Toronto, especially on social assistance rates, 100% of your income is going to your rent. You have nothing left over. And you're not going to be able to afford food no matter how hard you try.
Elizabeth Fletcher asked the question, did you look at food supply in your research? I imagine there was a lot of oversupply normally destined for restaurants and catering that would have been spoiled. With reduced capacity going forward at restaurants and caterers, shouldn't we be rerouting that supply?
Yeah, it's an interesting question. So we were part of the City of Toronto's Emergency Food Access Coordination Group, and we certainly did. They received a lot of donations from restaurants and that sort of thing, and we were able to redirect it. But I think ultimately what we're talking, it's kind of it's a nice concept when you think of surplus food, people not having enough food. It's an easy match, but it's a temporary, it's kind of a band-aid. It might meet that immediate need in that moment, but it's not going to solve the root of the problem. So for us, we tend to try and look upstream at what is causing that food insecurity, and redistributing surplus food. Again, it's just not a long-term solution. So we ultimately want to look at those poverty reduction elements. But what we did learn was from a food access kind of point of view is that our respondents had a number of challenges in terms of accessing food in terms of grocery stores. So for example, prior to COVID, a lot of people would, because their incomes were low, they would receive flyers, they would go to different stores trying to get the best deals. But as a result of COVID, the public health guidance was to limit your trips to once a week to go to one grocery store. So people really struggled to, use their usual budgeting techniques during the pandemic. And for some people, there was limited availability of food. The products they want weren't always available, but by and large, I think if we had the income supports that people needed, the food redistribution wouldn't be such a necessary intervention to support food insecurity.
Good.
Val, do you want to
have a comment on that?
Well, I mean, I would agree with what Talia said. I think that, we've heard a lot about these Herculean efforts to capture the food that would otherwise have gone to waste because of the disruption in food, restaurant facilities or institutional feeding or other sorts of uses of food that have been disrupted because of the shutdowns related to COVID. But, I think in some ways that might be more a conversation about food waste and how to manage food waste and how to avoid food waste in a time of disrupted food supply or food chain. But I think it's important to keep the eye on the ball in terms of food insecurity. The reason that the policy recommendations in the Daily Bread report and the slide that I ended with, the reason that we're focusing on income and housing and healthcare benefits and other sorts of things is because those are the things that are moving the needle on food insecurity. And so, if we want to get at the root causes of this problem and reduce these numbers as opposed to, continue to watch them climb, then we've really got to tackle those underlying issues. And, yes, there's a parallel need to tackle issues of food waste and to make sure that the food in our food supply is well used and that it's consumed, not landfilled. Absolutely, that's important. But in some ways, I guess I'd say that these things are divergent. Periodically, they converge, like now with the efforts of Second Harvest. But, at the end of the day, the bottom line for food insecurity at the level of individuals and households is their resources.
Yeah. Nick Saul often says that food insecurity is not a food issue, it's an income issue, as a very simple, straightforward response to that. There are two questions about government resourcing. I'm going to combine the questions because they're talking about how the government makes decisions moving forward during what will be tough fiscal challenges. So the first is from an anonymous attendee. The federal government has a $343 billion deficit and $1 trillion debt. Where will we get the resources to expand income support and other poverty reduction programs? I'm going to combine that question with one from Lindsay, who says, do you think that during this unprecedented time that governments may be more receptive to policy recommendations to alleviate poverty, or will they be less receptive because of the massive recent levels of public spending? Should we be focusing on reallocation of budgets or increases in government spending to address poverty? It's not easy questions, but it's certainly part of the equation. Valerie, why don't you kick that off? And because I'm a colleague Talia, I'm going to give her a little break to think about that response.
Well, these are really good questions, but they're huge questions. So first of all, where do we get the money from? The reason I included that slide showing you about healthcare costs in relationship to food insecurity was in anticipation of a question like this. When we talk about this problem, it's important to recognize that it's costing us money now. It's just that the money doesn't quite look like the money we're talking about in these recommendations for policy change. So first of all, money's being spent every day on the fact that we have such a high number of people who are food insecure. I mean, I only showed you OHIP data from 1 year for adults, and that was 2015. No question, what I showed you was a gross underestimate of the costs associated with those people's health problems, let alone all the people that lived in their households, and let alone now the added health impacts that we must be seeing amongst this particularly vulnerable subset of our population through COVID-19. So there is money being spent, and could we reallocate that money? I think we could. The other thing that I would flag is, again, I don't think it's a zero-sum game here. I don't know if anybody else saw this, but I found myself riveted by an op-ed piece recently about the rich getting richer. And it was an analysis of what the impact of all of these federal benefit packages has been through COVID-19, observing that high-income people there's been a lot of work done to preserve the value of their assets and their investments. So the stock market has not bottomed out. Yes, there have been perturbations, but it hasn't bottomed out. And that's because there's been a prioritization in the allocations of federal funds. There's been a prioritization to protecting wealth. And so again, you know, going forward, are we looking for new programs, or are we looking to reallocate some of the money that's been spent now or that has been committed to be more effective? At the end of the day, we're not talking about a lot of people here. You know, I said 4.4 million, but, you know, think of how many people live in this country. That really isn't that many. And how many people are we talking about that are severely food insecure? I mean, you know, it's not that many people. So I think it's doable. I hope what will happen through COVID-19 is that we will be pushed to think more seriously about our priorities and about looking after each other. At the beginning of this pandemic, the logo was, you know, we're all in this together. And it's become abundantly clear that we're actually not all in this together at all. I mean, look at the maps that Talia included of Toronto, right? We're not all in this together, not by a long shot. Let's give our heads a shake on that slogan, right? If you've got one of those posters, take it down. You know, that's not what this is about. So I think, you know, it challenges us. We get a choice. We can carry on, you know, as usual, perpetuating the inequities that exist and that are being exacerbated through COVID-19, or we can use this as an opportunity to shake things up. I mean, obviously, I hope we do the latter. Okay, enough from me, Talia. What do you think?
No, I agree 100%. I think there's a few things. One is that, I mean, what keeps me up at night right now is a fear that we will move into an austerity budget mode. And we know that, you know, decades of austerity budgeting in a variety of countries have severely led to severe income inequalities that have produced a lot of health risks and food insecurity for people who are low income. So that is something that is absolutely worrying for me. And I think Val's right that we have these costs that are resulting from poverty. The challenges in a political cycle is that government ministries are very siloed. So a healthcare cost doesn't necessarily, the Ministry of Social Development doesn't necessarily track that or care so much about it. So I think if we are to move forward, our government really needs to take a step back and take a whole government approach to say, where are we prioritizing our resources? And Feed Ontario, which is the Provincial Association of Food Banks, they released a report just earlier this year about the cost of poverty, and they peg it somewhere between $27 to $33 billion a year in Ontario. So we have to think about the costs downstream, but we also have to think about, in terms of how we allocate funds, we have to remember that it's not just moving around between spending, we also have to think of the revenue side. So how do we balance, where are we getting revenue in from, where are we putting that revenue towards? So that's the important equation that governments need to think through. Do I hope that they will take a poverty reduction lens moving forward? I absolutely do. That's what we'll certainly be pushing for.
Well, that's a great lead into to the final question for you both. In terms of next steps, how do we take the research that both of you have done and really mobilize a movement that will create the systemic change that we are looking for? How do we advocate for those changes? What's the best next step forward?
That's a great question. I think that there's a lot people can do. I think the most important critical thing is to stay engaged, to follow politics, to follow policy. And I know it can get technical and it can, be a bit overwhelming sometimes, but I think it's critical that people know, let their politicians know, their elected representatives know that Canadians care about these issues, that, I think bigger lobbyist groups, corporate interests, they get an ear to our elected officials, and that's why we see certain priorities come through. But I think if we can show that as a population, as Canadians, that these are issues that are top of mind, that's what influences decision makers. So it's not enough to tell your friends who you know agree with you. You need to actually be going out and writing to your MP, writing to your MPP, your city councillor, and letting them know that as they're making decisions, this is what's important to you as a voter. So I think that's really critical that people take that action on and, follow organizations that are doing this work. Daily Bread, we engage in advocacy, but we're by far not the only one. There's tons of organizations that do this work. We work really collaboratively with a lot of organizations. So, following on social media, looking for opportunities to amplify that voice, to share those messages, that's really critical.
Yeah, I don't know that I can say anything that adds on, that extends what Talia said. I think she's right on. I mean, the importance of things like this report is that they have rendered visible a very, very serious problem, right? And it's too easy for this stuff to happen and us not to recognize it. So the most important thing now, I mean, if you've taken the initiative to come on this webinar and to last for almost 1 hour, then you're already engaged. So thank you, but keep it going. Keep it going. As Talia said, it's so important that other people learn this story, that it not be, swept under the carpet, and that our elected officials understand that this actually matters to us and that this is what we want them to be acting on. Because there are so many competing voices for those people to listen to that we need them to hear this voice. And because if we don't, this situation will only get worse, right? It's only right now, it's only headed in one direction. It was headed in that direction before COVID-19. And I think the data from this Hunger Lives Here report and the new Stats Canada data on food insecurity suggests that the situation is worsening now. So it's really, really critical that we come together to say, look, this is a very, very serious problem and we want action on it, because the squeaky wheel is getting oiled through COVID-19. There's no question there.
Val, you've prompted me to add on one extra question after that, because I think we should end on maybe a different note in some ways. To both of you, what gives you hope right now?
Do you want to go first, Val? Do you want me to go?
Well, one thing that gives me hope is that CERB even got enacted, right? The speed with which that, income support benefit came into play, it is wanting on so many levels. Absolutely, I could do a whole other hour on that alone. But the fact that early on in this pandemic, it was recognized federally that we needed to deal with the fact that our existing social support structure, things like employment insurance in particular and social assistance, would not deal with job loss in the way that it was going to happen with COVID. I think that it shows the nimbleness of, if that's a word, of our elected officials, and there is an awareness of the vulnerability that is festering in the existing social safety net. So for me, that gave me hope. As we get further along now, we've seen CERB extend, which I think has been the right thing. I just hope that as that program phases out, that we'll have more effective and more seamless interventions coming forward. I mean, that still obviously is a work in progress for our governments. But yeah, the fact that it even happened, I think, gives me hope.
Talia.
Well, I agree 100% with that. I think the policy response has really given me hope, not only CERB, but just the rapid response to rising needs at all levels of government has been really remarkable. Our civil servants have done their job 10 times over. So kudos to all the civil servants out there. But I'd say also what gives me hope is just seeing how politically engaged people are right now. I think COVID, being in a crisis, it makes people really tune in and listen and hear what's going on. And we're seeing people get really active on a number of issues, whether it's, the return to school and seeing parents get really active. It's people are engaged and they're listening and they're watching and they're holding our elected officials accountable. And I think that's really powerful. That's really important in democracy. So that's certainly giving me a lot of hope and optimism.
Great. Well, both of you give us all on the call hope. I am very grateful that there are academics like the both of you who are committed to understanding the challenges ahead and more importantly, providing solid recommendations in terms of how we might be able to move forward. And so that does give me hope. We have a wonderful body that governs the organization. Our board of directors is thoroughly engaged with this organization and has pushed the management team and supported them equally in the work that we do here at the Daily Bread Food Bank. Representing the board of directors is Christine Yip, who has joined us now, who's going to say a few words. And just by way of introduction of Christine is the founder of Organizations for Impact, which works to improve the quality of life for people at work. Christine has a background in both organizational psychology and public policy, having conducted her own fair share of social policy research at the Mowat Center. She has a strong voice, for sure, on Daily Bread. Delighted that she's going to wrap up the call for us.
Thanks, Neil, for that honest introduction. So thank you. So I'm here on behalf of the board of directors. So I wanted to first thank everyone who is here today and who dialed in on this Zoom call. Pre-COVID, this definitely would be an event somewhere where we'd have snacks and drinks and we could all kind of get to know each other a little bit better. But we are on Zoom and we appreciate, we know we're all back-to-back Zoom calls, so we appreciate the time that you spent. Obviously, I want to thank Neil, Talia, and Valerie for their comments and the insights that they shared on this call. And Valerie, in particularly, on behalf of the board, I want to thank you for your involvement, not only today, but also in getting this report completed and drafted and out, and your feedback on the survey that we put out, as well on versions of the draft was critical. And we are extremely blessed that we had your voice around the table to ensure that our research and advocacy is contributing to longer term solutions to poverty. Also, I want to thank Peter and Catherine Hugh, Peter Uch and Catherine Hugh, for co-authoring the report and Tyler Schneer with Talia, and to Kathy McNichol and Sarah Strom for all your work putting together and organizing, coordinating this event. We really appreciate it. So in regards to, and most importantly, I want to thank the 221 food bank clients who took time out of their day to share their own personal stories of their own challenges that they've experienced during COVID, which, to be honest, we're still in. So, you know, those stories are quite raw, and to entrusting us with representing those in a way that could lead to more meaningful change and advocate for change in their best interest. And I think, you know, my heart is, you know, so appreciative of that. And just a few words from the board in regards to this work. So the board is extremely proud and committed to the work that Talia and her team and the research and advocacy work we do at Daily Bread. We do see it as a big responsibility, although most people, when they think of Daily Bread, they think of the yellow bins in the grocery stores and the trucks they see around the city distributing emergency food relief to people who need it. It is our responsibility to ensure that we are advocating for longer term solutions to poverty and hunger in the city, that we are bringing awareness and educating all of the individuals who touch our organization, from donors to volunteers to agencies, on the longer term solutions and the sort of deeper rooted issues that drive food insecurity, and that we're amplifying the voices of those who come to our food banks every day. You know, 2 years ago as a board, we committed to taking a rights-based approach. So really recognizing formally food as a human right. And while, you know, what that means is we will be supporting kind of policies that help to realize that right, but it also means that the way we operate our organization and the way we do our research takes a rights-based lens. So amplifying the voices of those who are most impacted is what I see as one of the most important roles that we have. And I think this report really embodied those objectives. It amplified the voices of people who are most impacted. It took a rights-based lens to look at the policy solutions from a municipal, a provincial, and a federal perspective. And I think it did it so in record time. So Talia and the team, the turnaround of this report was extremely impressive. And just finally, I think as has been mentioned numerous times, we are in sort of a policy window or a window for change. I think with the pandemic and with the anti-Black racism movement, the gaps in our social safety net are more clear than ever. And to be honest, I think more people are listening than ever have been. And what they really need is to make sure that they have the information and the data to actually push for real change. And my hope is that this report is part of a variety of initiatives to help put the right information in the right people's hands to drive change. So with that, thank you all. I'm excited that everyone's here to have this discussion. I'm happy to know that this report is reaching a lot of people. I look forward to the work that Talia and her team will continue to do in this vein, from advocacy to more research. Our Who's Hungry report is going to be coming out in September, I think, October. Sorry, correct me if I'm wrong. I don't want to. November, sorry, November. And I hope you're all sort of engaged in that. And as Talia said, you know, remain engaged in this topic and have those discussions with your peers. I'm having them with my parents at family dinners to really kind of try to push for more longer term sustainable change. So thank you all very much for being here. And thank you, Talia, Neil, and Val, and everyone else on the team.
Thanks. Thank you, Christine. We've had a number of questions about the presentations and whether or not they'll be publicly made. I can say that the Daily Bread one, we'll make sure that that is available on our website. And Valerie, I don't want to speak for you, but I'm hopeful that you would consider allowing us to post thank you. The conversation continues, and so thank you everybody for being here this afternoon, and wish you all the best.